there is a lot of misleading information being spread about the COVID-19, rumors. So what we do suggest is that you follow up with the Ministry of Health in terms of their Facebook page. Also, there's information that's readily available from WHO, World Health Organization, or from Caribbean Public Health Agency. So for further information on COVID-19, we can visit the social media outlets or social media pages of the Ministry of Health, so the ST.KITTS Health Promotion Unit on the Facebook, on Instagram, and also on YouTube. Or we can just call 467-1172 or 467-1108.
The symptoms of the coronavirus are similar to those of the common flu or cold, which are consistent coughing and sneezing, fever that does not go away, and difficulty breathing. If you are experiencing any of these symptoms, it is advisable to stay at home until you recover, or if you want to go to your doctor, call first and tell your doctor of your symptoms, any recent travel or contact with travelers. And lastly, please avoid spitting in public. Recent cases have shown that people most likely to be at risk if they contract the virus are persons over age 60 and persons that have an underlying medical condition such as hypertension, diabetes, kidney disease, or a respiratory condition. It is advisable to avoid large crowds or other places where you might have to come in contact with people who are showing signs of the coronavirus. This is a message from the Ministry of Health and the National Emergency Management Agency, NEVIS.
When you feel a sneeze or a cough coming, try to prevent sneezing or coughing into your hands, as this will contaminate your hands and spread germs. Covering your mouth prevents the spread of germs. You probably knew that, but the way you cover up also matters. And that means breaking a habit you've done all your life. Cover your mouth and nose with flexed elbow or a tissue, not your hands. Discard the used tissue in an appropriate bin immediately. Then, wash your hands with soap and running water to help stop the spread of germs. Turn on water. Wet hands. Apply soap and lather up. Focus on washing your hands for at least 20 seconds. Wash the front of your hands, the back, between fingers and around the nails. Rinse hands under running water. Use something clean to wipe your hands, preferably a disposable paper towel. The best way to wash your hands is using running water and soap, but sometimes we don't have that available. When not available, use hand sanitizer that should have at least 60% alcohol content. Your health is your responsibility. This message was brought to you by the Ministry of Health, St. Kitts.
Currently, there are rumors and falsified reports circulating on social media about the novel coronavirus. For accurate information and updates, visit the Instagram and Facebook page of the Health Promotion Unit or the Ministry's YouTube channel at ST.KITTS Health Promotion Unit or ST.KITTS HPU. You may also visit online the World Health Organization or the Caribbean Public Health Agency. For further contact information, please contact the Ministry of Health for more info at 467-1172 or 467-1108. You can also be sure to follow the news to get the local COVID-19 updates. Let's all try to remain healthy and well. This is a message from the Ministry of Health and the National Emergency.
Team COVID-19. Step into the mic in the studio. It's Dr. Laws, our beloved CMO, Medical Chief of Staff, Dr. Wilkinson, and Mr. Lesroy Williams. Team COVID-19 on the front line, coming to you in Calypso rhyme. So sit back, relax, and listen to what they have to say and the role they want you to play. Easy.
Early in January this year, our federation woke up in fear because a little virus out there in Wuhan was slowly making its way to our land. They say its name was SARS Corona, and our lives it planned to devour. So we're here to come up quickly with a little plan to save our beautiful nation.
If it's a plan they want, then plan they will get. Because of people's lives we have to protect. Close down the airport and send back them big tourist ships so we could focus on this pandemic. Mr. MCS, I'm begging you please, as I pray to God from down on my knees. Now let's get all our hospitals and staff in order to battle this corona.
Well, Madam COO, I hear you loud and clear. We will win this fight, don't worry, don't fear. I'll sound the alarm and get all hands on deck. This war we will win and our people protect. To win this war we must flatten the curve, but don't overwhelm the nurses and doctors. Personal responsibility you must take indeed if we are to succeed.
Cover your mouth, we say cover your nose. This will stop the spread to those who are close. Lock yourself inside during the curfew. Under quarantine to thine own self be true. Wash from your elbows down to your hands with soap and water, it's a simple plan. If you follow these simple instructions daily, from this virus we'll soon be free. Easy! Now I know what you're thinking, but I only assisted with the recording. This song is not my composition, but brought to me by Dr. Wilkinson. Between Hillis Roy and the CMO, they've come up with this great kaiso. So after whipping COVID-19 behind, there'll be Sugar Mass 49. Easy!
Good day and a very warm welcome to the National Emergency Operations Center COVID-19 briefing for the 12th of August 2020. I am Lesroy Williams. Thank you very much for joining us for this COVID-19 press briefing. We continue to update you on what is happening in the Federation of St. Kitts and Nevis with respect to the management of the COVID-19 pandemic, which has been, in St. Kitts and Nevis, managed very effectively. And I think that, we are an example in terms of how the COVID-19 pandemic has been managed regionally and internationally. Today, I would invite Ms. Ophelia Blanchard, Coordinator of E-Government, to give us a presentation, the Federation of St. Kitts and Nevis, COVID-19 Repatriation Form. Ms. Blanchard.
Good afternoon to all listening on radio, TV, on the internet, and persons who are overseas, in particular persons from the diaspora and persons who are unfortunately got trapped overseas wanting to return home. And just to say that the COVID-19 task force has been working assiduously to look at reviewing the protocols as well as refining the protocols in accordance to the Emergency Powers COVID-19 number 13 regulations. And permit me to refer to the regulations to highlight that in section number 11, restriction on international travel, for the purposes of preventing, controlling, and suppressing the spread of the novel coronavirus or COVID-19 with immediate effect, A, all airports, including private airports and fixed base operations, shall be closed to incoming international flights, except with the prior written permission of the airport's authorities in consultation with the Chief Medical Officer. Now, it is in this context that we seek to look at the repatriation process, and we want to highlight some of the improvements that you can expect effective immediately. So first, I would start with a warning. Do not attempt to travel to the Federation of St. Kitts and Nevis without prior approval, as we would have made reference earlier to the regulations. However, just to note that to facilitate this process, we have looked at digitizing the repatriation process, and you can access the form on the covid19.gov.can website. If you have any questions regarding repatriation process, please email us at covid19taskforce@gov.can. Next. Please note that all persons returning to the Federation of St. Kitts and Nevis will be subject to a mandatory 14 days quarantine in a government-designated or pre-approved quarantine facility. As you look at the form, you would note that the incoming travelers to St. Kitts and Nevis are required to complete the form. There are highlights in terms of an asterisk, highlighting the required fields that persons would have to complete. Please note that all information that is provided will be kept in strict confidence, kept confidentially. What I would do is to walk you through the sections of the form. Personal details and contact information. You would note on the screen that we have last name, so it's important that you enter your last name, the first name, Middle name is optional, but you can include that as well. Passport number is very important. The gender, date of birth, place of birth, nationality, email, cell phone number, and persons can actually enter, if they have a WhatsApp, they could also enter their WhatsApp number. Now we go to the next section as it relates to the emergency contact. Now we would want you to provide an emergency contact, preferably someone in the Federation of St. Kitts and NEVIS, for which we can contact if there's an emergency. So all information here is required: the contact name, the email address of the person, emergency phone number, and the relation. The next section relates to residency. Your residential address while you are in St. Kitts and NEVIS must be completed, as well as your residency status. For example, your KITTISION, your NEVISION, you have a work permit, your residential, etc. Country of residence, the residential address of your current location. So for example, if you're in San Antonio, Texas, you want to put that particular address here in the residential address in the current location where you're at. Reason for leaving St. Kitts and NEVIS. So for persons who are in St. Kitts and had to leave perhaps for study overseas or vacation, you'd want to select that information. And if you are studying, then you want to indicate the educational institution for which you are studying. The next section looks at the travel history. Now we want you to identify the different countries that you would have traveled in the last, it's saying 6 weeks, but we want to cover the last set of travel that you would have done when you were overseas. So US or Puerto Rico, for example, you would select each country and it would be listed directly below. The date of last departure from St. Kitts and your intended date of return to St. Kitts. In the next section, we look at additional passengers. The additional passengers section should only be added if there are other persons traveling with you. So if there are other persons traveling with you, you would click on the plus sign. If not, you would leave it at 0. Flight information. For the flight information, we want to identify all the connecting flights required to return to St. Kitts. If at this time you wouldn't have a booking for a flight, you would not complete this section. However, if you do, you will click on the plus sign and then you can add the flight information. For the flight information, you would have to enter the flight number, the airline name, the port of embarkation and port of disembarkation, as well as the date of arrival and the time of arrival. The next section of the form referred to the preferred quarantine location. When it comes to the preferred quarantine location, we are asking persons to contact either OTI or Royal St. Kitts Hotel, which are the two designated quarantine locations as of now. You'd have to contact the number and make a booking. The next section looks at the upload documents. One of the documents that we would be required to upload is a passport data page. Here you would upload the passport data page, and once you've uploaded it, it's going to note the name of the document. Note here that we accept only the PNG file, JPEG, or GIF files. The next step is to download the blank form for the port health surveillance or notice of quarantine or isolation form. So the first step is you download a blank form, you print it off, complete it, scan, and re-upload. At the end of the process, you would click on the Submit button. Once you click on the Submit button, you would be directed to a confirmation message which will notify you that emails will be sent to your email address, that's for the main contact, to keep you updated on the status of your application. Just to note that the task force is going to review the application process and review your details that you submitted. Once a decision has been made within about 48 hours of submitting your application, then you would receive periodic updates. For example, if your application has been approved, you will receive an email notification that your application has been approved, and you'll be advised to update your travel information as it relates to your flight bookings. And you would also be informed that you would have to submit the COVID-19 test. That would have to be a negative test that would be submitted. So that is more or less the end of the process for the online submission form. Thank you.
Thank you very much, Ms. Blanchard. I now invite Superintendent Cromwell Henry, Divisional Commander for District A, to update us.
Thank you, Mr. Williams. A pleasant good afternoon to all listening to this broadcast via whatever means. New regulations have been published and came into effect on August 8th. These regulations have further eased some of the restrictions previously in place and prepares us for the reopening, or in order to prepare us for the reopening of our borders. Restrictions on private parties and social events still remain in effect. However, the new regulations have made provisions for the Commissioner of Police to grant permission for these events after consultation with the COVID-19 task force. So we see there's an opportunity for social activities to take place, provided that they would have meet the approval of the task force and the Commissioner of Police. There was also further easing of restrictions on sporting events. Previously, only training and practice matches among individual teams were allowed. The new regulations have now made it possible for clubs to host inter-team or inter-club practice matches. However, these matches or these type of events must be spectatorless. That is, the stadium stands should be free of spectators during the event. Matches can be streamed virtually. Before these events can be hosted, however, management teams or clubs within each sporting discipline may apply to the Ministry of Sports specifying the date of the event, the participating teams or clubs in the event, the number of players, the number of supporting staff, the proposed health measures for the event, etc. This information should be provided on the prescribed form, which would be obtainable at the Ministry of Sports. Again, all of these easing of restrictions still require all persons, including players, to observe the basic COVID-19 protocols. That is, the wearing of masks, the physical distancing, good hand hygiene, and sanitization behavior. We continue to implore all persons, whether you are participating in a social activity, whether you are participating in a sporting event, or just being in a public place to always wear your mask, keep your hands clean, and maintain physical distance from the person nearest to you. I want to thank you for listening, and be safe.
Thank you very much, Superintendent Henry. I now invite Chief Medical Officer, Dr. Hazel Laws, to present us with the COVID-19 situation report.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Center situation report for today, August the 12th. Based on the information or data coming out of the World Health Organization, the total number of confirmed cases of COVID-19 has passed the 20 million mark. And so at present, we have 20,162,474 confirmed cases of COVID-19. Yes, we have passed the 20 million mark. In terms of deaths, the death toll stands at 737,000, above 737,000. In the United States of America, in terms of the total confirmed cases, there are over 5 million cases in the United States alone. And in terms of the death toll in the U.S., it's almost 165,000. What's happening in the Caribbean region? Now, based on the latest situation report coming out of the Caribbean Public Health Agency dated August 10th, the total number of confirmed cases within the Caribbean region stands at over 129,000. But then the good news is we continue to fare quite well in the Caribbean. The total number of recoveries, almost 63,000, and the death toll continues to be relatively low, just about 2,000. However, the Caribbean Public Health Agency situation report continues to state that the risk of further cases occurring within the Caribbean region remains very high as we continue to accept our nationals from overseas, from hotspots. Okay, so what's happening locally? We are aware that we've only had 17 positive cases to date, and the good news is that they have all recovered. So at present, there are no active cases within the Federation. So far, we continue to test suspected cases and their contacts, and we continue to test nationals who would have returned from hotspots. And so to date, we've tested over 1,300 persons so far. At present, we have 53 persons in quarantine. These are nationals who would have returned. And we have, of these 53, 24 in quarantine here in St. Kitts and 29 on the island of NEVIS. And so far, since we've been accepting nationals, since the closure of our borders, that's between April the 24th to present, the total number of nationals who have returned to the Federation so far stands at 163. Again, let me repeat, at present, there are no active cases of COVID-19, as far as we are aware, within the Federation of St. Kitts and Nevis. Having said that, if you were to look at the Center for Disease Control and Prevention, on the St.KITTS and NEVIS, you will realize that there is a travel advisory stating that we are at level 3. What does level 3 means? It says and so this is the advice given to persons in the United States who are residing in the United States. This is the advice they are getting. They are being told to avoid non-essential travel to the Federation. If you were to peruse the site, it says COVID-19 risk in St.KITTS and NEVIS is high. Wow. I want to reiterate that at present there are no active cases of COVID-19 within the Federation, and so what we see here is really a misrepresentation of the situation as it exists on the ground. Next. Okay, just some further updates coming out of the New York Times today. There was an article that speaks to reopening of bars and restaurants in the U.S. and what they have found is that, or data coming out of the United States of America show that many of the new COVID-19 cases in the U.S. this summer are centered or can be traced to restaurants and bars. So quite a number of cases, new cases of COVID-19 in places like Louisiana, Maryland, Colorado, were traced to bars and restaurants. And so what the science is showing, or seems to be showing, is that indoor dining seems to be far more dangerous than outdoor eating. So the epidemiologists are arriving at consensus that indoor dining, especially in bars, seems likely or more likely to lead to outbreaks than outdoor settings. And so having said that, the bars and restaurants in our federation are open, and they are open to indoor dining. And so I just want to use this opportunity to remind the operators of bars and restaurants. I want to remind you of the non-pharmaceutical or non-pharmacological measures that are being used to control this pandemic so far, the wearing of the face mask. So we want the operators to insist that your patrons, your clients, enter at least wearing a mask and utilize same when they are not eating and drinking. Remember, hand hygiene is of paramount importance, and so there should be the availability of simple soap and water or hand sanitizers at the entrance and at appropriate locations within your facility. General hygiene is also very important, and so it's the need for you to clean the high-touch surfaces regularly, like the doorknobs, the knobs to the bathroom or the restroom, the counters, and even the tables where persons dine. So that's very important. We want you to use cleaning solutions that are appropriate for such settings. Remember physical distancing, and so the location of the tables around the chairs, and you should have appropriate number of chairs per table in keeping with the physical distancing and social distancing. I think it's our individual and collective responsibility to avoid big crowds. And so if you want to eat out and you go to a restaurant or a setting and there is a big crowd of people, it's your responsibility to just turn away and choose another location where the crowd is not so large. So thank you.
Thank you very much, Dr. Laws. I hope that the CDC or some representative from that institution is listening to this press conference so that they can correct the erroneous information that has been placed on their website. I now invite Mr. Abdia Samuel, Chair of the COVID-19 National Task Force, a national disaster coordinator to address us. Mr. Samuel.
Thank you, Mr. Williams. And a pleasant good afternoon to all who are listening via all the means. Today we continue with our briefing, and I just want to highlight a few points as we prepare to open our borders. Yesterday in the Prime Minister's briefing, press conference, he would have indicated that the month of October is being targeted as the month whereby our borders may be opening. Again, let me emphatically state, because I have been receiving a lot of calls, that the month of October has been the month of October has been considered as the date for reopening of all borders as indicated by the Honorable Prime Minister. Now, yesterday the task force would have met with the senior management, in particular the chairman of the St. Christopher Air and Seaport Authority. And one of the things, as we continue to look at generating economic activities and building relationships, so when we return to that state of safe operations, we can have our international partners give us preferences, because it's a competitive world and everybody is doing their best to establish themselves out there in the investors market. So what do I say? We have been in discussion with the Royal Caribbean Cruise Line, where they are seeking to have layover of vessels in St. Kitts. Now, this dialogue again is ongoing, and we are looking at the possibility of having maybe 2 to 4 cruise ships dock at our ports for a period of approximately 27 days to a month, thereabout, ensuring that they will follow all the protocols prescribed by the Federation. We have been having this discussion, analyzing all the pros and cons, and a consensus has been reached whereby economic activities and a beneficial long-term relationship can be gained by allowing this to occur under the terms and conditions set by the federal authorities. Now, this discussion is ongoing. Nothing is written in stones, and we are hopeful that in the near future we can get back to you with some further information. What does this mean? Basically, as well, that the ships may have 60 to 70 crew members on board. These are men and women who have families, friends, and being on sea, cruising without nowhere to go, nowhere to live, basically. Let me just say that. Living on the ship is one thing, but having the ability to have your foot on the ground is another thing. So we have to be mindful that they are human beings, and we are giving consideration to this situation. So we will get back to you, the general public, with more concise information regarding this venture. Again, let me repeat that October has been basically looked at as a potential date of opening our borders. What does this mean? This means that the measures being put in place to guide the general populace in adapting to the new norm has to be adopted by you. You have to have that buy-in. We have been doing everything to ensure that the non-pharmaceutical measures that we have been advising over and over are ingrained into our way of life now. This has to have a cultural change, and this is what is required for us, a cultural change. because we are not going to go back to the normal thing. Even if tomorrow a vaccine is found, it's not like we're just going to flip a switch and we're going to go back to the normal. And we can see what has been happening. I can vividly recall that Dr. Wilkinson would have made a reference to New Zealand and the dance the Prime Minister in New Zealand would have done when they had the last recovery. And 102 days later, you see that New Zealand is now shutting down areas within New Zealand. And this is one of the things that we are saying we want to try to avoid here in St. Kitts and Nevis. The shutdowns and reopenings from the trends and patterns that we have been seeing is rather impactful on the economy, is rather impactful on the human being, in particular, our psychological well-being, and it's also impactful on our surroundings. So therefore, we are asking you to adopt the protocols that we have been advising you to, continue to do your research, and join the all of society approach to building resilience in St. Kitts and Nevis. Now, what is going to be required in opening our borders? The policies and procedures that you see, we are continuously working on. We have the regulations that we continue to enhance every time they conclude. And we also look at infrastructure development. You see what we are hoping to put in place at our borders in particular, and what we are doing in strengthening our medical sector. Also, you see what the ongoing training that is happening. And that is very critical, because that is what's going to shape the behavioral change that will be required for us to remain resilient or to become resilient. So these are critical things that you have to consider in terms of opening the borders. Now, let's be really mindful. Every single country that has opened their borders have had cases. So we are going to get cases in St. Kitts and Nevis. That's the reality. We cannot run away from it. It's inevitable. But what can we do so that we don't run into this seesaw effect, open and close, open and close? And it's by simply having you adapt to the new norm. I mean, you're still walking up 4th Street and you see 75% of the population not abiding by social distancing, not abiding by physical distancing. Again, I remember when everybody were walking with big bottles hanging from the side with alcohol. You're not seeing that now. Sanitizers now basically have become useless to some people, while others are doing their best. You hear Dr. Law speak about the restaurants and the bars, and I could recall in the meeting with the bars and the restaurants, persons were adamant that they don't think we need to do this, we don't think we need to do that. And these are the things that we are refusing to do that are going to help us to remain resilient. So we need to adapt. That's the reality. We can't run away from that. If we don't, all what we are doing right now is going to be useless. We have the hurricane season that is ongoing. We have peaked. We have now reached the time where we're going to see more frequent storms. We have that tropical depression 11 that's in the Atlantic at this moment. The forecast or the trajectory of this depression, tropical depression 11, seems to be passing north of St. Kitts and Nevis. However, we know that weather is dynamic, and by tomorrow we can have a different trajectory. What do I say? Please continue to prepare. Please review your hurricane plans, and if you don't have one, you have time to create a plan. It is important for you to know what to do, who to contact in the event that we are impacted by one of these storms. We have reached out. The National Emergency Management Agency has placed all of its national response mechanism on alert, that in the event we become under any type of advisory, there will be meetings held on Friday this week. So therefore, all of the NEMA stakeholders, partners, please be on the alert in the event that we are placed under any advisory, that you can act as quickly as possible. Continue to prepare. We need you to be prepared. With that said, thank you, and we look forward to your questions.
Thank you very much, Mr. Samuel, for your presentation. Did I hear you say when a vaccine is found? Apparently you were not listening to Vladimir Putin. And, you know, that might be debatable and something for discussion in terms of a vaccine and the phases of a vaccine and whether this met the requirements of that, if it is safe, and so on. But we have come to the question and answer segment, and the first question goes to Dr. Wilkinson. When a vaccine comes online, the first world countries, USA and UK, will have access to the vaccine first, and we may find ourselves last in line for the vaccine. The Prime Minister addressed a question on this yesterday and did not appear to be overly concerned. Do you, Drs. Wilkinson and Laws, have any grave concerns as a health professional that this vaccine may not be readily available to us? Dr. Wilkinson.
I think to answer that question, we have to look at what is happening here locally and also regionally. So here in the Federation of St. Kitts and Nevis, you heard the report from the CMO. We had 17 cases, and they're all recovered. We have had no deaths so far. And the 17 cases that we've had, they have all been import or import-related. And Madam CMO, if my memory serves me correct, most of them came from the first world country, the imports, yes. Okay. And we have not had any local or community spread. We have also been able to successfully keep it out of our institutions like the nursing homes, the prisons, the schools, etc. And so without a vaccine, we have done quite well with the prescription of non-pharmaceutical measures that we have been using. If you, however, look at the first world country, for example, just now at the United States, we heard just now that they have over 5 million cases and over 164,000 deaths. And so they are in greater need of a vaccine than we are down here. And so if a vaccine comes on board, I believe our recommendation would be that it be used there first, and we are willing to continue doing what we're doing and wait in line to use the vaccine. So I don't think we are at a disadvantage.
I want to add that there is a facility, a COVAX, C-O-V-A-X facility that is being developed and formed by the Pan American Health Organization, World Health Organization, and it provides an opportunity to member states where it's a facility whereby we can have access to vaccines when they do become available. And so there is a facility whereby CARICOM member states you can express your interest to be a part of this facility, and at the end of the day, the long-term gain would be that of accessing vaccines when they become available. Thank you.
This next question, we had 17 cases. Sorry. Sorry about that. Sometimes the technology gives up on you. The health professionals, I think, did a good job at containing the virus locally. Yet we had an advisory issued against the Caribbean and St. Kitts and Nevis in particular. Do you think we should make a strong statement denouncing this advisory? Dr. Wilkinson.
I think the CMO addressed this in her response, where she indicated what we were doing locally, and in the first question, I addressed what we've been doing locally in terms of our success here in containing the virus, and regionally in the Caribbean, we have been doing much better than the rest of the world. I believe that any strong statement about that should probably come from the Caribbean heads of government, but we still have to engage with the U.S. after COVID-19. And sometimes some persons say don't bite the hand that feeds you, and we know that that's our major source for tourism. And so I believe that we just need to let the facts speak for themselves, the fact that we are doing well and continue to advertise what we're doing. And I believe that the persons in the first world, they can see that we are doing a great job here. So I don't think that we need to make any strong statement in denouncing, but just continue to do what we're doing.
Would you like to?
Mr. Williams, with regards to that question, I just want to add something to complement what the good doctor was saying, is that the number of requests that we are getting from U.S. citizens wanting to come to St. Kitts and Nevis, I think is enough to address that particular advisory that was issued.
The third question. Since the introduction of the fine for not wearing masks, has there been more compliance, or has the police been issuing tickets? Superintendent.
Yes, since this particular provision has been made about the issuing of tickets, personally, I've seen a greater, a better improvement in the wearing of masks. I've seen more people who are wearing a mask. I'm even seeing people driving in their vehicle wearing a mask. And so I think that has reached home to people that it is important and that we are serious. In terms of the issuing of tickets, that has not started yet. We are in the process of having the tickets printed. But as I said before, our intention, we are not eager to issue tickets. What we are eager for seeing is the persons wearing their masks. So if persons can wear their masks voluntarily, we'll be happy for that. We will not have to issue any ticket. But if it comes to that, the tickets will be ready just in time.
This is the fourth question. The Prime Minister indicated that the borders may be open in October. Does that mean that we will soon be seeing cruise ships back in our ports and planes flying in and out? Mr. Samuel.
Okay, let me address the question with the cruise ship. According to the information provided by the St. Kitts Tourism Authority, there is no likelihood right now that any cruise ship may be coming to our shores for this year, maybe for 2021, based on some of the statistics and some of the logistical challenges that is required to have cruise ships scheduling to come to our ports. As it regards to the aircrafts, yes, we will be seeing aircraft coming into St. Kitts and Nevis. That's one of the reasons we are opening the borders. So we have to prepare for all of that. So yes, aircraft, various aircraft will be entering our ports, and that's why we are doing all we are doing in terms of enhancing the infrastructure, policy development for having incoming passengers enter safely into St. Kitts and Nevis.
I just want to add something to what Mr. Samuel said, and maybe he didn't mention it just now since he spoke about it in his presentation. He spoke about the cruise ship layover, and so no, we're not going to be having any cruise ships coming here anytime soon with hundreds of tourists coming off. But in terms of the cruise ships for the layover, where the crew that have been circulating the oceans since March, and they're asking if they can berth here, we may be seeing 2 or 4 ships coming here in a safe way, where the persons would be quarantined on the ship, tested, and retested after 14 days before they are allowed to leave. So there might be ships coming here pretty soon, but not tourists coming off the ships. It's the crew who have been stranded on the ships who would be coming off in a safe way.
Thank you, Dr. Wilkinson. This fifth question, we have been hearing for some time now about pre-certified home quarantine. My daughter is scheduled to return from overseas, and I would like to have her quarantined at home, as I believe she can be adequately isolated at home. Where are we with this process, and to whom do I send my request? Mr. Samuel.
Thank you for that question. And as it regards to the status of the progress we are making with those criteria, the criteria should be completed no later than tomorrow to Friday, and the application will go to the COVID-19 task force at gov.kn. Again, send it to the email COVID-19 task force at gov.kn, and you should have a response within 48 hours. However, the criteria are not ready yet, so therefore your apartment cannot be considered as yet. Hopefully by the middle of the month to the end of the month, we should be ready for such. Thank you.
Thank you, Mr. Samuel. This next question, which I think has been answered before, once the borders are open, what will be the protocol for visitors moving around the island? Will they be required to be quarantined for 14 days? Dr. Laws.
Okay, at present, as I said before, as we've been saying, nationals who are residing in hotspots, they are submitting requests to be repatriated home. Over 160 of them have already returned. And the existing protocol we are using requires them now to provide us with a pre-arrival molecular COVID-19 test. And they're going to compulsory quarantine. They're tested on day 14. Once they're negative, they are allowed to integrate into society. Now, I want to state that based on the science as we know it with respect to COVID-19, this remains the best approach based on the information that we have. This approach reduces the risk of introducing or reintroducing the virus to our federation. So now, come October, as Mr. Samuel says, that's the proposed date of reopening our borders. When that time comes, we will have to establish the protocols for the reopened borders at that time. Now, from where it stands, for now, it would be, persons would have to be in quarantine for 14 days and tested before they are released. However, between now, mid-August to October, that may change. And so what I want to say is when the borders are reopened, we will have established protocols to guide the process of accepting tourists from hotspots at that time. And again, we will continue to be guided by the science. Who knows, maybe we would be able to shorten that period of quarantine, but as we speak now on August 12th, we are not sure what the protocol for reopening in October would be with respect to the period, the full period of quarantine. Thank you.
Thank you very much, Dr. Laws, for your response. That brings us to the end of our question and answer segment for today. However, in contrast to the CDC warning, the United Kingdom has put out a list of countries in which St. Kitts and Nevis is included. And people from St. Kitts and Nevis traveling to the United Kingdom, they do not have the requirement of them being quarantined for 14 days. What a contrast. Really showing that someone has gotten it right and someone has gotten it wrong. That brings us to the end of our National Emergency Operations Center COVID-19 briefing for the 12th of August 2020. I thank Ms. Ophelia Blanchard for her presentation on the Federation of St. Kitts and Nevis COVID-19 repatriation form. Superintendent Cromwell Henry for his update with what is happening with respect to the COVID-19 regulations. Our Chief Medical Officer, Dr. Hazel Laws, who continues to update us in terms of what is happening here and within the region and globally with respect to the COVID-19 pandemic. And of course, today she mentioned that St. Kitts and Nevis has 0 active cases of COVID-19. We also thank Mr. Abdia Samuel, Chair of the COVID-19 National Task Force and National Disaster Coordinator, and of course, for his invaluable support and availability, always here to answer questions. We thank Dr. Cameron Wilkinson, Medical Chief of Staff at the Joseph N. France General Hospital. We continue to thank the media for partnering with us in the dissemination, management of information with respect to the pandemic, and all who continue to play their part in society, in all institutions, organizations, in terms of adhering to the COVID-19 protocols and measures that have been implemented to keep us all safe. Thank you very much for joining us. I forget to thank our sign language expert, Mrs. Christmas Jacobs, for always being here and providing her service. Thank you for listening. Thank you for being with us today. Next week we will be back with another NEOC COVID-19 briefing. There's no briefing on Saturday, right? Right. So we'll be back next week, Wednesday at 5 p.m. Until then, take care. I am Les Roy Williams.